One of the things about the importance of the breath and the excursion of the diaphragm when we're eliciting a pelvic rhythm through the breath is that the diaphragm, not only does it move down so that the abdomen can expand, but it also is, because of its tent-like structure, it also moves down and supports the rib cage to move out to the sides, and it also expands the rib cage at the back of the body. So it's quite important that we have an awareness of where our diaphragmatic breath tends to settle. And the thing about the body is that it will always take the path of least resistance. So if we have very flaccid abdominals, for example, the breath will tend to come out into the front of the body a lot more than it will out to the sides and to the back of the body. And that can actually start to set up some issues with overactivity in the lumbar spine and tightness in other muscles. So in order to check that our diaphragm is actually moving well, we can actually use a little bit of biofeedback from our yoga belts by taking the belts around the lowest margins of the ribs and just place the belt really lightly in your hands so that as you take your breath in, you're noticing the breath gently pressing to the lower rib cage, particularly at first to the left and right sides, and noticing what excursion of the circumference of the belt that you're managing to move. So for some of us, that might be a couple of centimeters. Maybe as our diaphragmatic excursion improves, we end up with an inch or so of movement. And then we're tuning into the back ribs and noticing, are the back ribs expanding? And this is really important for the lower back. Because if the back ribs aren't expanding and the breath is just reaching into the front of the body, then there is often a lot of overwork, tightness, discomfort in the lumbar fascia and the lumbar muscles. And this feedback will help us to ascertain where we need to just actually take a little bit more of awareness for the breath. So we can also take the belt a few centimeters down so that it actually cinches the waist very lightly, because anytime we put a lot of pressure on the waist, we are in fact pushing abdominal pressure downwards, which isn't necessarily great for the pelvic floor. So we want to keep it light around the waist. And then we would take some deep breaths here and notice if the waist expands out to the sides and towards the back of the body here also. 5 or so breaths with lateral awareness, left and right sides. 5 or so breaths with a posterior body awareness or back body awareness. And finally, 5 or so breaths with awareness to the abdominal area. And of course, if we don't want to use a belt or we don't have a belt available, we can use the manual feedback from our hands to actually reach around to feel the side ribs, or even one side rib at a time, and the other side rib, and take the breaths with the manual feedback from the hands. Hope that's helpful, and see you on the next one.